please assess your patient, and is it necessary to examine all the patient in Plab 2? Patient will give you a page, and so when you will ask about the idea, it will complete your eyes. Hello guys, assalamu alaikum. This is Dr. Faraz Ahmad. So what happened in the normal life when we take history from our patient? So after taking the history, we examine the patient, and after taking history and after doing the examination, we move toward the management plan. So in the previous video, I told you about history taking. So now today we will talk about the examination of the patient. So what happened? This is a very common question from the people, from the students who are going to take the Plab 2 exam, and the question is this: that is it necessary to examine all the patient in Plab 2 exam? The answer is no. You will have to examine maximum 1 or 2 of the patient in your Plab 2 exam, but you have to verbalize the examination in almost each and every station. This is very important. Like, you have to verbalize in each and every station. For example, you have taken the history. After taking the history, you will say, ideally I would like to examine you, and it will include observations including blood pressure, pulse rate, respiratory rate and temperature, and I would like to examine your chest, your tummy, your front passage, your leg. Depending upon the case, you will tell the patient. But what happened, like if your question is saying please assess your patient, and if your question is saying you have to examine the patient, then definitely you will go for the examination. But if your question is not saying about it, you will just verbalize. When you will verbalize to the patient, like, I would like to do the examination, may I proceed? When you will say this, most of the time what happened, that examiner will give you the findings. At some time, what happened, your patient will give you a page, and on that page all of the examination findings will be written. So what you will do, like, you have to read the page and then you will verbalize the examination findings to your patient, and you have to verbalize in a way like you have examined your patient. Like, you will say, oh, thank you very much, Mr. Jones, for letting me to do the examination. As I have taken your observations, so your blood pressure is on the higher side, and your pulse rate and the temperature are quite normal. If you want, you can skip the normal things as well. And then you will say that I have examined your tummy and I have noticed some tenderness on the lower side of your tummy. Or you can say, I have noticed some noisy sounds in your chest. So you have explained the examination findings to your patient. So now, after explaining the examination findings, we will move toward the diagnosis, and diagnosis is part of the management. So as I mentioned in the history, that where you have to ask about the concerns of the patient and where you have to ask about the expectations of the patient. So here, before telling the diagnosis to the patient, you will ask about the idea of your patient. So when you will ask about the idea, it will complete your eyes as well. So before telling the diagnosis and after doing the examination, you will ask your patient, do you have any idea what's going on with you? The other way you can ask, do you have any idea that what could be the problem with you? Or you can ask in any way. What happened, like sometime patient will tell you, doctor, I could have heart attack, I could have appendicitis, this type of thing. So if patient tell you the diagnosis, this will ease your work. But what happened, in some time patient will say, doctor, no, I don't know what happened to me. Then you will move toward the management, and first part of the management is the diagnosis. You will explain the diagnosis to your patient. So now I will talk about the 8 to 9 steps of the management in a separate video. Please keep watching. Thank you very much.